Did you know that there existed separate hospitals for humans and animals during the time of Ashoka? Did you know that as early as 600 BC, ancient Indians were preserving dead bodies to study human anatomy? This is the second video in the series where we explored the medical knowledge of ancient Indians. In this video, we specifically focus on the hospitals, system, and infrastructure during those times. So stay tuned and enjoy this video. And I promise you an awesome session of infotainment. Hello and welcome to the fourth episode of Indic Insights. In the previous video, we explored the antiquity of medical science in ancient India. A brief recap here would be convenient. At Mehergarh, an archaeological site from 7000 BC located in present-day Balochistan, several bodies with drilled molar teeth have been found, suggesting evidences of dental healing. In the sites of Kalibangan, Barzohom, and Lothal, which are Indus Valley sites approximately dated to 3000 BC, several skulls have been found with holes in their temporal region. This suggests evidence of a brain surgery known as trephination. This method is still used by present day doctors to drain out excessive fluid from the brain during brain hemorrhage. The Rig Veda, Atharva Veda, and the epics like Ramayana and Mahabharata too contains numerous references which indicate traces of medical knowledge in the ancient times. The foundations of ancient Indian medicine or Ayurveda were laid by the six disciples of sage Athreya, conservatively dated to 6th century BC. They founded the six schools of Ayurveda. Those texts are lost now. However, the earliest available text which formed the foundation of ancient Indian medicine is the Charaka Samhita by Charaka, which is dated to 3rd century BC, and the Sushruta Samhita by Sushruta, which is dated to 6th century BC. Now let's look at the medical system that evolved in the ancient India. The inscriptions of Ashoka from 3rd century refer to cultivation of medicinal plants and hospitals in his kingdom. The inscriptions also mention separate hospitals being built for humans and animals. Charaka Samhita talks in detail about the designs of hospitals and pharmacies. It suggests that hospitals should be well ventilated and spacious enough for the patients to walk. The patient should not experience any kind of unpleasantness in the form of sound, fumes, smell, or intense glow of sunlight, smoke, or dust. Expert chefs, masseurs, doctors, nurses, and pharmacists should be hired. Animals like deer, cow, birds with singers and musicians should be kept in the hospital premises to maintain a pleasant environment. Hospitals should also have an ample supply of food and drugs. Charaka Samhita also talks in details about pharmacies and the role of pharmacists. Pharmacists are required to be trained in grafting and care of plants. They should also be able to extract the juices from flowers and preparing medicinal preparations in the form of powders, pills, liquids, etc., using different techniques such as fermentation and distillation. Chanakya's Arthashastra talks about punishments and penalty of physician in case of carelessness, negligence, suppression of facts, or administration of adulterated drugs. Physicians were expected to report to the government in case of any infectious diseases or epidemics. Census of the population was also conducted. A register of birth and death was maintained, and causes of death were also maintained. Toxicology or study of poisons was also well developed. We might have all heard about the Vish Kanyas during the time of Chanakya. There used to be a special class of physicians known as Vish Chikitsak who were expert in toxicology and poisons. There were other classes of physicians such as Kaya Chikitsa or experts in general medicine, Sena Chikitsa or military surgeon, Pashu Vaidya or veterinary doctors, or Sri Rog Vaidya who were experts in obstetrics and gynecology. There existed a concept of community health. The temples, ponds, roads, and environment were to be kept clean, and people causing pollution was punished. People were hired to supervise different departments such as forest, horses, elephants, and cattle. They were also instructed to prevent cruelty towards animals. Fishes in ponds and rivers were also to be protected. The inscriptions of Ashoka boast about his commitment towards stopping of slaughter of living beings and how he was successful in controlling hunting of wild animals. Charak and Chanakya talk in detail about the importance of proper diet, lifestyle, and daily routines, such as getting up early in the morning, practicing of yoga and meditation, cleanliness and hygiene. For example, Charak recommends brushing of the teeth twice daily and cleaning of the tongue using a metallic scraper. He suggests using a twig as a brush and compound a mixture of honey and other powdered herbs as paste. Charek elaborately defines the roles of doctors, patients, and nurses. He defined the role of nurse as having complete knowledge and skill of nursing, affection for the patient, and cleanliness. To the patient, he advises to ignore doctors who practice just for money, when not qualified enough, or when too proud of their status. However, he also says that a good doctor must be respected as a guru. And to the doctors, Charak has provided a detailed code of conduct, similar to the Hippocratic Oath of modern day doctors. He writes, "He who practices not for money, not for caprice, but out of compassion for living beings is the best among doctors." Ayurvedic students were also expected to have knowledge of cooking, as diet was an important part of the treatment. They were also requested to travel extensively to know from where to collect the herbs. At the end of the training, the students were administered an oath in the presence of a king. The students had to be well versed in all the eight limbs of Ayurveda. The eight limbs of Ayurveda include general medicine, surgery, eyes, ears, and nose, obstetrics, gynecology, and pediatrics, psychology, toxicology, rejuvenation, and realization. This suggests that all these fields were well developed. Treatments of diseases such as leprosy, skin disease, mental disorders, diabetes, cholera, edema, diarrhea, etc., also finds mention in the Ayurvedic texts. Fahim, who visited India during the 4th century, also talks about the medical infrastructure during the Gupta Empire. Surgery too was well developed. We get a reference of an instance of surgery from the life of Jivaka. Jivaka was a legendary physician during the 5th century. He had studied medical science in the University of Takshila for 7 years. Jivaka is credited for treating Lord Buddha. A merchant suffering from head disease was treated by Jivaka. Jivaka tied the patient to his bed and cut through the skin of his skull. He then drew apart the flesh and took out two worms from the wound. And then he closed up the wound by stitching it and anointing it with some ointment. This incident tells us about the surgical progress of ancient Indians during the 5th century BC. Sushruta Samhita contains the earliest references for the cure of diseases such as leprosy, lithiasis, that is the formation of stones, and angina pectoris, which is a heart disease caused due to the insufficient flow of blood to the heart. Sushruta talks about dead bodies being used to study and understand the human anatomy. Sushruta explains in detail the process of preparing the dead bodies for studying. First, a cadaver was to be selected, cleaned, and the waste was to be removed. Then the body was wrapped in grass and placed in a cage. The cage was lowered into a river or a stream of flowing water. Once the body was significantly decayed, it was taken out of the river. Skin, fat, and muscles were brushed away from the corpse, and then the human anatomy was observed. All these from 600 BC. New doctors practiced incisions first on dead animals or plants. Large veins of plants were punctured and traced to master the art of surgery, while bandaging, amputation, and plastic surgery was practiced on dead animals. Shushrut describes 14 different types of bandages and also talks about the harmful effects of non bandaging. Shushrut also suggests that surgeons should carry a toolkit which includes surgical tools such as leeches, fire for sanitizing, cotton pads, suture, threads, ointments, water, butter, honey, etc. He mentions a variety of surgical tools, 125 to be exact, such as round headed knife, finger knife, different types of scissors, scalpel, hooks, toothpicks, probes, bone nippers, etc. Surgical procedures were divided into three stages: preoperative measures, operation, and postoperative measures. Certain steps were prescribed for pain relieving during surgery. For example, starvation or mild diet was advised on the day of the surgery, and intoxicating drinks were advised to avoid the pain of surgery. During surgery, doctors were advised to use the tool rapidly and only once to a desirable depth to minimize the pain of surgery. Postoperative measures involve usage of opium or morphine for analgesic or pain relieving effects. Sushruta suggests several innovative ways to perform various surgeries. He suggests using a horsehair as stitching material. Black carpenter ants were used to close incisions in soft tissues. For example, during intestinal surgery, Sushruta suggests to bring the two ends of the intestine together and firmly press them. And then black ants were introduced to grip both the ends with their claws. And the bodies of the ants were removed and then the area was stitched up. Leeches were used to suck pus and blood in case of boils, tumors, or other similar conditions. Leeches could also be used when bleeding was an issue and surgery could not be done. Sushruta writes about different kinds of leeches and suggests that only some kinds of leeches could be used for surgical purposes. He also writes in details how leeches should be caught, preserved, and used. With this, we come to the end of this video. In the next part, we will focus on the achievements of ancient Indian medicine, its influence on the other world cultures, and its influence on modern medicine. Meanwhile, if you did enjoy this video, don't forget to like this video, share it with your friends, and subscribe to our channel. Also, feel free to check out our previous video on the history and origin of medical knowledge in ancient India. Thanks for tuning in, and I will see you in the next video.